Welcome to the deep dive. Today, we're tackling something that honestly feels a bit sci-fi artificial intelligence, but looking at how it's actually changing something very real, how hospitals are run.
Yeah, it's fascinating stuff.
We've sifted through quite a bit of material to pull out the key insights for you. Think of this as your shortcut to getting up to speed.
Mhm.
Our mission today is simple. Understand the real benefits, the big challenges, and what's next for AI in hospital management.
And it's a really crucial area. AI isn't just like a tech trend here. It's fundamentally reshaping administration and clinical work.
Right.
And importantly, it connects directly to that big global goal, the SDG, for healthy lives for everyone.
Yeah.
It's about making healthcare work better, fundamentally.
Okay, let's talk efficiency then, because some of the numbers are quite startling. I saw something about predictive algorithms cutting waiting times quite dramatically in South Korea, like up to 30%. How does that actually work?
Yeah, absolutely. Those algorithms are, well, they're game changers.
Hmm.
They chew through massive amounts of data admissions, historical patterns, staffing levels, you name it.
Okay.
And based on that, they can forecast demand, help optimize where staff need to be, even predict when beds will free up.
Right.
Think about the pandemic.
Right, COVID.
Exactly. Those tools were vital for figuring out where to put critical resources, like ICU beds, making sure they were ready before the surge hit. It's proactive.
That makes a lot of sense. Moving beyond just the flow, what about the impact on, say, patient care directly, and maybe also the costs involved?
Well, on the patient care front, AI-assisted robotics in surgery is a big one. It allows for incredible precision.
Uh-huh.
Leads to faster recovery times, too. We're seeing places like Japan and Germany really adopting this for complex operations.
Okay.
And then there's telemedicine, huge growth there, helped
Yeah.
by AI like virtual assistants and chatbots. It's boosting access, especially, in remote places.
Uh-huh.
China and Japan are big on this.
Sure.
But don't overlook the admin side, automating those routine tasks. Our sources suggest that alone can cut hospital running costs by maybe up to 20%.
20%. Wow, that's really significant. And you mentioned something else that surprised me, sustainability. AI helping the environment in hospitals.
It's true. It might sound odd, but AI can fine-tune things like the heating and cooling systems, the HVAC.
Yeah.
That can cut electricity use by, say, up to 15%. Plus, it helps manage inventory much better, predicting needs so there's less waste from overstocking or expired supplies.
Okay, so multiple wins there, efficiency, cost, even green impact, which I guess leads to the big question. If AI is this beneficial, why isn't it just everywhere in hospitals already?
That's the critical point, isn't it?
Yeah.
And a major hurdle highlighted in our sources is, frankly, human resistance, people resisting change.
Really?
Yeah. It's kind of surprising, but data suggests over 60% of doctors in the U.S., for instance, still lean towards traditional diagnosis methods over AI.
Why is that? Is it just mistrust?
It's partly trust, maybe.
Yeah.
Concerns about AI being a black box. You don't always see how it reached a conclusion. There are also liability questions. What if the AI gets it wrong? So there's this strong preference for keeping a human in the loop.
And I imagine dealing with patient health data. Privacy must be a huge flashing red light, right? How do you manage that ethically?
You've nailed a core ethical challenge there. Protecting patient data is absolutely paramount, especially when AI needs so much of it to learn effectively.
Mm-hmm.
Plus, there's the very real danger of algorithmic bias.
Oh.
If the data used to train the AI isn't diverse, the AI might actually end up reinforcing existing health inequality.
Making things worse for some groups.
Potentially, yes. Less accurate diagnoses or treatment recommendations for certain populations. It's a serious risk we need to manage.
Okay, so human factors, ethics. What about just the practical stuff? The nuts and bolts?
Absolutely. Big practical barriers exist. Lack of the right tech infrastructure is a major one, especially if you look at developing countries, like Peru, for example. Implementing sophisticated AI just isn't feasible everywhere yet.
And the cost, I assume?
Oh, definitely. The upfront investment to get these systems in place can be really high. It's a significant hurdle. You see this playing out in Latin America. Places like Brazil and Mexico are further ahead, showing these disparities in readiness and funding.
So thinking about the path forward, it sounds like we urgently need some clear rules, ethical guidelines, regulations,
Yes.
and maybe developing AI that's tailored more locally, not just using models trained on data from, say, North America or Europe.
Exactly right. We need frameworks, and we need AI that understands local context, local populations. The potential, though,
Mm-hmm.
especially for remote or rural areas like parts of Peru,
Oh.
it's huge.
How so?
Well, think about AI-powered telemedicine. It could bridge massive gaps in access to specialists, really changing healthcare for communities that are currently underserved. It's about solving real access problems.
So wrapping this up, what's the key takeaway for you listening? It seems pretty clear AI could radically change hospitals, making them more efficient, accessible, maybe even greener.
For sure. But its ultimate success isn't just about the tech getting smarter. It really hinges on us figuring out the human side, the adoption hurdles, the ethical questions.
Which leaves us with a final thought to consider. How do we, as a society, make sure this incredibly powerful technology gets rolled out fairly responsibly so that it genuinely helps everyone, everywhere? That's quite a challenge for us all to think about.